Welcome to the Emerging Pearl Show. I am Eliza Boné, your host and creator of the show, which is dedicated to inspiring women to embrace a life defined by love, passion, healing, and serenity. I am very excited to be hosting the show for the first time since I launched it. In the previous 3 episodes, I was behind the scenes producing the show. Today, I am honored to step into the host role, thanks to production assistant John Cage. This segment will explore the challenges and benefits of alternative healthcare. I am passionate about this topic because for years I struggled with health challenges, which were often compounded by Western medicine. It wasn't until I tried alternative modalities that my health began to vastly improve. However, for many years I was resistant and I hesitated to trying this approach. But my goal today is to shed some light on some common questions and concerns that we may face when deciding whether to try natural solutions. Today, we have an amazing panel of alternative health practitioners from the Whole Health Wellness Group. Joining us is Connie Burgstahler, a licensed massage therapist and certified hypnotherapist. She is also the founder and CEO of Whole Health Wellness Group in Vancouver, Washington, which was recently voted Best in Clark County in Acupuncture and Naturopathy. We also have Dr. Sara Larson, an integrative health naturopathic physician and licensed acupuncturist who offers primary care. Dr. Larson is passionate about giving her patients the time, support, and care to enable the healing power of nature to reduce, if not resolve, many health conditions. I would also like to welcome Amanda Fields, a licensed massage therapist who specializes in Thai massage and is passionate about sharing the benefits of massage, especially with those that are suffering from chronic pain conditions. Welcome, ladies.
Thank you. Thank you.
Alternative health care has not been viewed as mainstream for many years.
Correct. It really has not. Mainstream is our Western. Alternative is really combining, I do believe, the Western and the Eastern medicine together. We have the ability to fine-tune our health care, and alternative medicine has been there for so many centuries, just classified as other modalities.
So Connie, tell me about your vision. When you decided to open Whole Health Wellness in 2014, what were you envisioning for that practice, for that group?
Thank you. I was envisioning a space where I was able to bring a multitude of different modalities into a one-shop stop, I guess is what we would call. I started off with 5 rooms, a couple of massage therapists and a naturopath. I'm now up to 12 rooms, and I have naturopath, acupuncture, physical therapy, massage therapy, hypnotherapy, and it's still growing.
It is. That is exciting. In your opinion, has the mindset of people in general perhaps shifted? Are we embracing some of these alternative modalities?
Absolutely, absolutely. I watch people all the time who have been in Western medicine for so long that have come in because of one of the other therapists or doctors, and they're amazed at how well they do under different care, how much gentler that the approach is. Instead of medication, that they can look at it in a different way, either through diet or through body manipulation, through actually through hypnotherapy, depending upon what their needs are. These people are coming in with a openness, and we're greeting them, I think.
That is amazing, the growth that you've probably seen just in the last few years.
Mm-hmm.
You shared some really interesting statistics with me, and I was really impressed because according to this study by the National Center for Complementary and Integrative Health, 33.2% of U.S. adults use complementary health approaches.
Mm-hmm.
So that's about 59 million Americans who are spending their out-of-pocket money because most of these practices aren't covered by insurance. Is that correct?
Correct.
But they are spending 30.2 billion per year.
Correct.
So that is an astonishing number of people that are actually embracing alternative health care.
Absolutely. Absolutely. And also, too, their insurance will pay for a lot of this now, which is wonderful.
Now, do you feel that as you run your wellness group,
Okay, I am a massage therapist for the past 17 years. I also do CranialSacral. I do somato-emotional release. I'm a hypnotherapist in regression. I also do zero balancing. I do a lot of cancer massage and a lot of modalities around the cancer patients. I have cancer patients from just finding out about this all the way to end of life. I do scar mobilization, so when there is surgeries, so surface scarring versus visceral scarring, and I also do that. So my modalities are vast, and when you come in to see me, you're doing not just one modality, you're getting most likely all of them all wrapped up into one.
that's interesting. I know some of the different modalities you mentioned. Maybe a lot of our viewers aren't familiar with them. There was one that I recently tried personally. It was CranialSacral. Can you tell me a little bit, in a nutshell, what is it? How does it work? Just for our audience so they can understand some of the different practices that are available to them.
Sure. So yes, CranialSacral is a modality that I use quite often with many of my clients. It's based on the theory of osteopathy. It has the ability to move the bones in the cranium. So the suture lines are boundaries for our bones in our skull. It also moves the fluid. The cranial system is based on a rhythm that we have in our body. And there's so many different rhythms in our body. And this is just one of them. We follow the rhythm. We get people from their sympathetic into their parasympathetic, where they're balanced and calm. And that really helps quite a bit.
It sounds lovely, and I actually experienced it personally, and I was very intrigued by the concept, and I was impressed by how gentle the approach was, and I was so relaxed, and I understand it's safe for moms and babies as well.
Absolutely, absolutely. It's wonderful for them, as well as the very frail. My cancer patients come in just for that.
Oh, thank you for sharing that.
Thank you.
So, Dr. Larson, in your experience, what are some of the challenges and barriers that people face when they're deciding whether to pursue natural health care?
Well, thank you for thank you for the question, and thank you for allowing us the opportunity to be on your program, Eliza. The barriers that I see with patients, some people I'll see for the first time as a naturopath and a licensed acupuncturist, but they have perhaps been exploring and have their own experiences with seeing a naturopathic physician and or an acupuncturist. But some people come to me who've never had any kind of experience whatsoever. And the first step is getting a good history. And I think people are a little bit surprised with how long we talk. We have a lot of time in the room. So I think that when people are experiencing naturopathic medicine for the first time, they realize that there are things that they're going to be responsible for things that of their own. That it's not going to be a one-size-fits-all treatment plan. It's not going to be take a pill and go home and you don't need to change anything. Mm-hmm. A lot of the conversation I have with patients is arousing that sense of curiosity in them to explore eating differently, exercising differently, getting good sleep, changing aspects of their lives that they do have a lot of control with, but perhaps don't feel empowered to do so. And then if we're going to be doing supportive modalities like Western herbs, perhaps even medications, or the whole world of Chinese medicine that's available, hydrotherapy, homeopathy, we have a huge tool bag from which to choose. But the biggest challenge that I see is that patients are a little bit uncertain how to move forward.
Yeah, that's interesting that you touched on the process of actually seeing you versus Western. I know with my personal experience, when I go to the doctor, it's quite a lengthy process. I spend most of it in the waiting room, mm-hmm. and then I'm seen by a nurse, and she takes vitals, and she asks a few questions, and then I wait some more. And I spend a lot of time waiting, and when the doctor finally comes in, they're in a rush. Yep. They're behind schedule, and I'm struggling to get across some of my concerns. Mm-hmm. And it's 10, 15, maybe 20 minutes if I'm lucky, and I walk out of there with a prescription in hand and not feeling very confident about my health actually getting better, because I did not have that real meaningful conversation mm-hmm. with the doctor. Tell me what a patient might expect when they go see a naturopathic physician.
There are a lot of differences between naturopaths, how we choose to practice. People might focus on a particular modality or a way of conducting their best medical care. Some people specialize in herbs, some people specialize in pediatrics, people will specialize in physical medicine. But when a naturopath or when a patient comes to see me for the first time, you can expect a 90-minute visit, which is quite an extraordinary period of time to be spent with just the physician. I do try to get people back on time and respect their time. I don't want people to wait in the waiting room for more than a couple of minutes if need be. And we take a really extensive history, a personal medical history. We go through medications, supplements, allergies, medical conditions, whatever the top 5 things perhaps that bring them in the door, as well as what their health goals are. And I hope by the end of the visit that we have moved toward achieving some of those goals. Some people have a really concrete goal. They want to go to Disneyland by a certain date and be able to walk without pain. Other people want to just see a change in their labs perhaps, or people just want to feel better overall. So in the 90-minute visit, I also do any pertinent exams that are required. We do the same kinds of exams that a lot of people are used to having. And in that time, I also, if people are interested in acupuncture, and that's part of what brought them to see me, then I also offer an acupuncture treatment the first visit. And the other part of it, too, is that people can never just be a sore knee or a hurt back or a high blood sugar. They are mind, body, spirit. So part of the extensive history is also to ask questions that seem to go far afield of perhaps what initially brought them in the door, but I can't separate mind, body, spirit. So I do want to know as much as I can, and we get to know each other more in successive visits as well.
So I'm really glad you mentioned some of these different practices that you incorporate during your patient's visit. I'm an essential oil wellness advocate, and I also mentor women through natural health solutions. And I make it a priority to make sure that the clients feel heard and that they feel that they're going to be supported every step of the way. It's a partnership, and a lot of what I do, I've learned from personal experience what I don't want to do to others.
Yeah.
I agree that we definitely need to take a holistic approach to health. Dr. Larson, what is your ultimate goal with your patients? I know that you do look at them as a whole, and you're not just treating a specific condition or symptom.
I want them to graduate.
Yeah. You want them to get better.
I want them to feel better, and I don't want them to feel like they need to come and see me all the time. I'm not the one doing the healing, they are. And that's something I try to spell out pretty carefully, because empowering people to care for their own health and their wellness, as well as any disease state, we're not necessarily going to fix everything, and not everything is meant to be fixed. But when people leave, they feel like they have all the tools that they need. And people do come back and see me for acupuncture on a weekly or a monthly or even a seasonal basis, just to maintain levels of health. But what I really want is I want people to feel like they have the tools necessary to fly.
Yeah, and that's so important. Empowering them. I love that. Empowering them. For so many years, I felt the doctor was in control of my health. Medication was going to determine how I felt. And I had no control. I felt I had no control over my wellness. And it wasn't until I tried alternative health care and all these different modalities, that's when I started getting better. That's when I started healing. That's when I started getting off all this medication. And I love that you're empowering your patients to get better and to participate in their wellness.
And that's a big piece of it, because with that freedom also comes responsibility.
Yes.
And one of the philosophies of naturopathic medicine is docere, doctor as teacher. So we do spend a lot of time teaching and explaining. Not every patient wants to know every detail, some do. But if people want to know information and understand how their bodies work biochemically, physically, digestively, neurologically, then I'm happy to spend that time showing people how their bodies actually function so they have a better understanding. And taking responsibility is a big part of what we do.
Yeah, that's so key. Thank you for sharing that.
Thank you.
Now, I know that you also are an acupuncturist.
Yes.
So some people could be a little leery of that, the needles, the fear, is it going to hurt? Can you tell us a little bit about how that works
Certainly.
and what patients can expect?
Certainly, and I love having newbies. I love having patients come see me who've never experienced acupuncture before, and I wish there were a different word besides the word needle. It's an entirely different experience than, say, having your blood drawn or having a tattoo or other ways that people might experience needles. So when I was in school, we used to practice on each other a lot as we were learning, and one of my teachers often said the puncture comes first, the acu comes later. So we would practice on each other, certainly, and acupuncture started to get really quite painful for me as I went through school, and I didn't want to have a lot of acupuncture. So I approach patients with that same idea that they're nervous, they're a little scared, perhaps I take their vitals right before we have their very first acupuncture session, and sometimes their blood pressure's up a little bit, their pulse is up a little bit. And what I do try to explain is, though, I cannot take away a novel experience from you, nor do I want to. I want you to have your novel experience of acupuncture. What I explain is that I do a more gentle style of acupuncture, and we are with the use of needles or the use of cups or the use of gua sha tools or a Taitian device that I also have, which is a non-needle technique. We are correcting the qi and blood flow that has been disrupted by disorder, disease, pain, and poor health conditions. So we're just trying to correct the flow of qi and blood in the body. And using needles at particular points has been shown over thousands of years of observation to help resolve a lot of pain, disorder, and disease. We're not going to cure a lot of things. So I'm not going to unfuse a back that's been fused, or we're not going to grow a broken leg back together in one session. But I do think people can note a lot of relief when we do it. And when a patient is ready to have acupuncture, I start very gently, and I let them know that you may or may not feel the poke of the needle, and that's okay. But once the needle is in, if you feel an ache, if you feel nothing at all, or you feel a sensation of something moving, that's fine. But pain is not what I'm going after, so if the needle is troubling you, let me know, and I promise that I will come back and either fix it or I'll remove it.
So it's something that everybody should try at least once.
Yeah. And not everybody needs to love it, and it's not meant for everybody, but a lot of people can see good results.
Oh, thank you for sharing that. I've tried acupuncture several times, and I've been amazed that I very rarely, if ever, even feel a little prick.
Good.
It's so relaxing as well. Just chilling there for 15, 20 minutes and letting the energy adjust and change.
Let the chi flow.
Let it flow. Thank you, Dr. Larson.
Thank you.
Another modality that is actually one of my favorites is massage therapy. And I can personally attest to the healing power of massage. As someone with chronic pain issues and fibromyalgia, I use massage as the cornerstone of my pain management. So Amanda, you mentioned that some of the challenges you face with clients is that doctors can sometimes dissuade patients from seeing alternative practitioners for common conditions. For instance, if someone is struggling with a headache, their doctor might recommend medication instead of going for a massage. Tell us your views on this and how a massage can be just as effective or even more so than medication.
Okay, well, it is frustrating to get a potential client, call in and cancel their appointment because their doctor told them not to get a Thai massage because they have a headache, when they should come in because they have a headache, because Thai massage is a perfectly valid modality to help them through that. With medication, especially if you have a chronic condition like fibromyalgia, if you're taking it, you're constantly in pain, so you're constantly having to take something to help relieve that pain. Over time, it could be damaging to the body. But with massage, it's more facilitating and helping your body to help itself. It facilitates pain relief and enhances physical function. And so more importantly, massage is really helpful because I can also send my patients with tools like exercises and stretches to prolong the effects of their massage. So these are something they can do for themselves at home.
So needless to say, massage is definitely one of my favorite therapies and something that I personally recommend to others. Ladies, thank you so much for joining me and for sharing such valuable information with our audience. I hope you have enjoyed today's discussion and discovered some helpful insights on alternative wellness options. As a wellness advocate and mentor, I am passionate about supporting women struggling with the lingering effects of fibromyalgia, anxiety, depression, and overwhelm. By making a different choice, you have the power to bring healing and serenity to your life. The challenges and obstacles you have faced are irritants. However, remember that a pearl cannot be created without an irritant. Use your life experiences to reveal your beauty, your strength, your courage, and your resilience, and let the pearl within you shine. To learn more about the work we do, or if you have questions about alternative health resources, please email me at theemergingpearlshow@gmail.com. Thank you so much for tuning in, and I encourage you to subscribe to my YouTube channel, The Emerging Pearl, to see prior episodes. Until next time, and remember to reveal the pearl within you.